Hi, everybody. Thank you so much. You guys are the true wellness warriors. You're here at the close of a great day, an amazing day, really. I mean, how well is this conference named, right? The WOW Conference, right? I mean, that's what we do it all for, right? We do it for the WOW, right? Isn't that what we do pretty much everything for? So it's pretty great. And thank you very much for being here with me. I really appreciate it. And for you being here to learn about libido, I'm going to talk about that, and why it's actually really good for us to have a good libido and have that contribute to a healthy sex life. I'm Dr. Liz Lyster. I am an OB/GYN doctor. At this time, I don't do OB and I don't do GYN. What I do full-time is hormone balancing. And it's really fun. I'm really, really blessed in my job. I help women and men of all ages. I help kids and teenagers and adults with all sorts of conditions, and we really look at all of the hormone balancing, and we are going to spend some time today talking about all the things that contribute to that. On a personal level, actually my personal expertise in my work has to do really with a really great time of life known as perimenopause and menopause. And menopause is when we've, woohoo, that's right. Menopause, the definition is 1 whole year without our menstrual period. Perimenopause can be 10 or more years leading up to that point. And then there's also a transitional process going on during all of that. So on a personal note, I am in that phase of my own life. I am 47 years old. I have 2 adolescent boys. I have a full-time job that I love, and I'm in menopause. And I have been down the road that a lot of my patients have been down, feeling some of the things that go along with that. And I wrote my first book, Dr. Liz's Easy Guide to Menopause. It's really about perimenopause, what's normal, what's not, and what to do about it. And the real reason I wrote that book is to help women know that we're not going crazy. Okay, and I love what Dr. Leslie Hewitt had to say when she started us off today, that it's not something that needs to be medicated either, that there's actually hormonal imbalances, there's underlying causes of what's going on. And so I have had some of these experiences myself. Some of the low mood, some of the disrupted sleep, some of my own private summers. And luckily for me, I have a really remarkable role model in my life. My mom, my parents are from Argentina. My mom is in her mid-70s, and she is vibrant and sexy and still working part-time, and she has always encouraged me to do what I need to do to feel my best. So that's really my message to people, and especially to women, that we don't have to feel old while we're getting older. That, in fact, my life isn't getting sad because I'm getting older. In fact, it's the opposite. That this time of life can be fun and sexy and delicious time. So who's interested in that? Yay. Yeah, okay, good, great. So the first thing I want to talk about with you is, why is libido important? I'm going to talk about 2 things with you. Why it's important and how you can use natural approaches to help boost your own libido. So the first thing I want to do is talk about what I mean when I use the word libido. So everyone always thinks of sex first. That's fine. But if you look in the dictionary, you'll find a multi-leveled definition. It really has to do with life energy, feeling of well-being, enthusiasm, motivation, feeling joy, enjoying what you're doing. All of that is libido. So when I talk about libido, I am referring to it in all of that full sense of the word. And of course, feeling good like that helps with a healthy sex life. And how do we know that sex is good for our health? Well, I'll tell you, from abundant scientific research, that's how we know. There are many, many studies. I'm just going to give you a couple of little samples today. For example, there are studies in men that show comparing frequency of sex among these men in this study. The men who had the highest frequency of sex had half the risk of dying of heart-related causes compared to the men who had the least frequency of sex. That's an incredible difference of the #1 cause of death in the country, right? For women, studies show the same thing. One little thing to add, though. It's actually the frequency of orgasm rather than just the frequency of sexual activity. So for us, it's a matter of quality as well as quantity. Okay? So research going all the way back to the 1940s, right? Kinsey report, these researchers that started things that long ago, showed that people with healthy, fulfilling sex lives had less anxiety, less being violent or hostile, and that sex causes the release of dopamine, endorphins, and oxytocin. These are chemicals and hormones released in our body during sex that cause an increase in feelings of feeling attention and feeling affection and feeling closeness. So also to say a word a little bit more to you about oxytocin. Oxytocin is really good for us. Oxytocin is released by the brain, and it has effects on the whole body. It's released during orgasm, it's released during sexual intercourse, it's released during breastfeeding. It is released pretty much in any kind of situation where we're having positive social interactions with other people. And it literally affects our entire bodies. It causes dilation of blood vessels, which improves blood flow, lowers blood pressure, lowers cortisol, improves mood. And because it's improving blood flow to all the organs in our bodies, it's actually associated with greater health and even with lower incidence of various hormone-mediated cancers. So oxytocin is really good for us. So that's really a little bit about the why libido and a healthy sex life is so important for our health. Now I want to talk to you about the how. How can you use natural approaches to improve your libido? And again, we're talking about libido in the full general sense, right? So there's 3 areas I want to cover with you. Briefly, I'm going to talk about lifestyle changes. I think we have a pretty healthy group of women at our conference today, and we've heard lots of wonderful speakers on this topic. And the second area is nutrition. And the third is really my area of expertise, which is bioidentical hormone therapy. So we'll spend a little time there. So in lifestyle changes, there's 3 things that I want to leave you with. The first has to do with healthy weight. Ladies, I didn't say skinny. Here's the deal with a healthy weight. Excess fat tissue that we carry on our bodies, it's not just sitting there bothering us. It's actually hormonally active. It's releasing chemicals and toxins, and it's disrupting our internal hormonal environment. And if we're not at a healthy weight, it gets pretty challenging to reach and maintain good hormone balance. The second thing is mindfulness. Any mindfulness practice that you're either already doing or that you can add to your life will benefit your health and your sense of well-being. And there are many, many studies that show this as well. Whether it's yoga or prayer or meditation, any of those are going to be beneficial to your health. So wherever you're at, if you can add 5 minutes to your day of any type of mindfulness practice, that's going to benefit your feeling of well-being, your libido. And the third is healthy and enough sleep. Yeah. With our overscheduled lives, the stresses that we live with, the going thing to do seems to now be do more, sleep less, and have a coffee or an energy drink the next day. Okay, so I don't know who in here remembers that movie that was called White Men Can't Jump. So sometimes when I'm feeling, kind of humorous with my patients, I'll say, well, I want to have another movie. It's called Tired Women Can't Screw. Okay. You know, it's a little crude, but it's true. The feminine receptivity that we require for a healthy sex life, ladies, we just cannot do it on caffeine. We just can't. So those are some lifestyle changes that are really important to our libido. The second area is nutrition, and we've had some great speakers on that as well. And besides the fact that what we eat, what we put into our bodies, becomes the basic building blocks that our body uses to make hormones and to make all the chemical processes that it's working on, aside from that, there are also herbal, nutritional types of therapies that can help directly with libido. So I want to share those with you. And this is of course true for men as well as women. For example, there are herbal supplements that improve blood flow, such as L-arginine and niacin. There are other supplements such as ginkgo biloba and tribulus that help directly with libido. Tribulus works very well in men and women. I get a lot of great feedback from a supplement that I use with my patients. I get equally good feedback from the men and the women with tribulus. And there are also for women supplements that help, as well as libido, help with menopausal symptoms. For example, black cohosh and maca root. And I have materials with me today that I can share with you that have all the spellings of that as well. Okay. And then the third major area under the how is really my area of expertise, and that's bioidentical hormone therapy. And a couple things I want to just convey before I give you some really amazing information on that topic. I realize that the phrase, just the phrase hormone therapy, often strikes fear into the hearts of women, and unfortunately into the hearts of doctors as well. And before I tell you why we actually don't have to be afraid of hormones, I want to tell you a couple things. The first is that if what I talk about sounds like something that could benefit you, it doesn't mean you need it forever. That's number one. Number two is that we are talking about therapies that can simply help you feel your best. And I just don't want you to be afraid of them. All right? So if that's what we get accomplished today, I will have done my job. So a lot of the fear of hormone therapy nowadays is based on information that came out from a study that began publishing findings 11 years ago called the Women's Health Initiative. Who's familiar with that study? Heard of it? Excellent. The DHEA, for short, we'll call it that. And there are two major areas of concern emerged from those findings, from that study. The first was in the area of cardiovascular risks, heart health, and we'll talk about that. And the other area, of course, is breast cancer. So the irony is that the DHEA study was undertaken by the pharmaceutical company who made the hormones used in it to demonstrate an improvement in cardiovascular health. And what they found was the opposite. I'm going to just cut to the chase and tell you that what we now know 11 years later, conclusively from numerous studies that have been done both before as well as since then, is that the increased cardiovascular risks that were found in that study, and by that I mean heart attack, stroke, blood clots in the legs, was entirely because the estrogen in that study was an oral estrogen. It was given by mouth. We now know conclusively that estrogen through the skin, spray, gel, patch, does not increase risk over placebo in the area of cardiovascular risk. So I want you to consider that. The other major area, of course, is the fear and the increased risk of breast cancer. And this is a very personal fear that I really understand. Thank God my mother is beautifully recovered from breast cancer quite a few years ago, and every time I go to get my mammogram, I get nervous. So I really can relate regarding this fear. And the DHEA study did show that there was a very small increased risk of breast cancer in the women taking the estrogen that they were being given and the progestin. Now, notice I didn't say progesterone. We'll talk about that in a moment. This was a synthetic, non-bioidentical progestin. We now have data, large studies, several large studies. One was from before the DHEA, several are since, both in the US and in Europe, showing that when you use a natural, bioidentical, meaning that the molecule is the same as what our ovaries produce, human ovaries produce, that the risk of breast cancer is not increased. So in fact, we can safely use estrogen through our skin and a natural bioidentical progesterone without the two major areas of concern that most women and most doctors have heard about and are concerned about. I want to say a little bit about what the benefits are. And what I want to talk about in particular are what I call the big four. The four main hormones. Of course, there are many, many hormones in our bodies. And the main four that help us women feel our very best are estrogen, progesterone, testosterone, and DHEA. And I'm going to go back through those now. Estrogen, as Dr. Sarah Gottfried says, is what makes us feel juicy. It's what makes us, it gives us feminine qualities, feminine characteristics. And it helps with temperature regulation. Right? I mentioned those little private summers sometimes. It helps with vaginal lubrication. It helps with mood. Low mood can often respond to estrogen. The second one is progesterone. Progesterone balances estrogen. Natural bioidentical progesterone has a sedating effect on the brain and helps us feel calm. It also helps with sleep. And it also balances the estrogen and can also help with joint pain. The third out of the big four is testosterone. The right amount of testosterone for women is a good thing. Too much or too little, not so good. Especially in combination, when everything else is balanced, a little bit of testosterone can be a beautiful thing for women. A lot of my patients don't even realize women make testosterone. We do. And the fourth one is the DHEA. DHEA is made by our adrenal glands, and it is the #1 hormone responsible for libido in women. And when our lives are filled with stress and not sleeping enough and not eating well, all the other things that we sometimes fill our lives with, our adrenal glands are going to prioritize. They're going to make more cortisol and less DHEA. So DHEA is really a quality of life hormone and can be supplemented to help us feel our best. So what I want to leave you with is that if you're not feeling your very best, if you're not feeling that full sense of well-being that we're talking about when we say the word libido, that there's a lot that can be done to check it out and a lot that can be done to help you feel better. And so I encourage you to do that because in fact it could save your life. Thank you very much for being here.